আরে লক হয়ে গেছে, কোনো ইয়ে হচ্ছে, সাউন্ড হচ্ছে না, সাউন্ড মানে মুভ করে না স্ক্রিন থেকে। এটা কোনো ডিস্টার্ব হলে ঠিক আছে, তুমি একটু থাকো, ভেতরে থাকো। তো সরি টু ডিস্টার্ব। The acute respiratory illness associated with recent radiological evidence of consolidation. So for pneumonia, two things is required. One is acute respiratory illness, another is radiological evidence. These two pneumonia. If only the acute respiratory illness, no sign of consolidation, it is not pneumonia. It is the acute respiratory tract infection. But if features of acute respiratory tract infection as well as radiological evidence of consolidation, then it is pneumonia. So for the diagnosis of pneumonia, two criteria must be present. One is acute respiratory illness. Secondly, radiological evidence of consolidation. There are different terms related to pneumonia. One is lobar pneumonia. Lobar pneumonia means when pneumonia is confined to a lobe of the lung. In the right lung there are 3 lobes, and in the left lung there are 2 lobes. So if pneumonic consolidation is confined to a lobe of the lung, it is called lobar pneumonia. Another is bronchopneumonia. When multiple segments of the lung, not lobe, but multiple segments of the one or both lungs is affected, it is called bronchopneumonia. Another term is community acquired pneumonia. Means pneumonia which occurs in healthy lung. Person is healthy, but suddenly he developed pneumonia. It is community acquired pneumonia. Another is secondary nosocomial pneumonia, means when pneumonia occurs in diseased lung. As per example, long time, and he or she developed pneumonia, that is called nosocomial pneumonia or secondary pneumonia. Now, what are the factors that predispose to pneumonia? As per example, cigarette smoking, elderly patients, any viral infection in the nose, and pre-existing lung disease. I have already told bronchial asthma, corticosteroid therapy. A patient is taking corticosteroid due to bronchial asthma a long time, then he may develop pneumonia. So these are the predisposing factors for pneumonia. Now the cause. If you consider 100 patients having pneumonia, then you will get 70% suffering from streptopneumonia. It is a variety of streptococcus. It is a variety of pneumococcus. So pneumococcus মধ্যে streptopneumonia variety, this bacteria is responsible for 70% of the pneumonia. Acquired pneumonia. It is very virulent organism. Healthy bacteria. And next one is mycoplasma. Mycoplasma usually occurs in childhood days. Childhood days, they suffer from mycoplasma. Next one is Haemophilus influenzae. It usually occurs in affected lungs like bronchial asthma, others. Legionella. It commonly occurs in elderly patients. Chlamydia, non-specific infection. Chlamydia can sexually transmitted disease, pneumonia. Another one is Staphylococcus pneumonia, and last one is viral. So new virus has been introduced in our chest infection, that is your COVID-19. Previously, influenza virus was common, but now COVID-19, it is the commonest virus that is causing pneumonia. About most of the cases of pneumonia nowadays in our country, not only our country, throughout the world, is by COVID-19 virus. Now, what are the presentation types of presentation? One is systemic presentation, another is local or chest presentation. Systemic presentation: fever, high fever, chill and vomiting. This can occur. And another one is your chest symptom: cough with rusty sputum, breathlessness. This can occur. And among the sign, on inspection, you will see that is movement is diminished on the affected site, and vocal fermenters will be increased. And percussion odidal, not stonidal. Bronchial breath sound and capitation present. At the same time, vocal resonance also increased. So yes, sir. তুমি জানো the Mycoplasma pneumonia has some special character. It occurs in children, and it is epidemic pneumonia. Legionella, I have already told that it commonly occurs in elderly patients, and this patient has got systemic feature, not the chest features common. Haemophilus influenzae occurs in COPD or bronchial asthma patient. Klebsiella, hospital acquired patient suffered from Klebsiella pneumonia. And viral pneumonia usually occurs following virus infection like influenza. Now, investigation. There are some differential diagnoses of pneumonia. It may be tuberculosis, it may be pulmonary edema, it may be malignant lesion. And by investigation, we can confirm whether it is pneumonia or tuberculosis or bronchogenic carcinoma. This is number one. Number two, if pneumonia, then what is the severity of pneumonia? Whether it is lobar pneumonia or bronchopneumonia, we can detect it. Thirdly, if lobar pneumonia, whether it is mild, moderate, or severe pneumonia, that can be also detected. And differential diagnosis of pneumonic consolidation: it may be your lung abscess, it may be empyemathrosis, it may be pleural effusion. some investigation for sputum, like sputum for gram staining, sputum for AB staining, sputum for culture. Sometimes blood culture is done, and some serological test can be done in if you suspect mycoplasma and Legionella. Now the principles of management of pneumonia. The principles of management of pneumonia, there are supporting treatment and antibiotic therapy. Among the supportive treatment, oxygen inhalation. Oxygen inhalation is given to maintain the oxygen saturation of blood, and fluid balance maintained, and because fever cause loss of body fluid and sometimes vomiting cause loss of body fluid, so fluid must be maintained, and nutritional support should be given. Last of all, antibiotic therapy. Now what about the antibiotic therapy? Antibiotic therapy, actually for antibiotic therapy we should send the sputum for culture sensitivity test, and we can start treatment with empirical antibiotics. And the common empirical antibiotics are your amoxicillin, number 1, number 2, your clarithromycin, number 3, your ceftriaxone, and other drugs commonly nowadays are used, that is levofloxacin. And so these are the drugs we can use empirically, and after getting the culture report after 72 hours we can give the final antibiotics for 7 or 10 days. Now severe pneumonia, we can detect whether the patient is suffering from mild pneumonia or severe pneumonia. So there are some criteria of severe pneumonia that is done by a formula, that is CARB 65. CARB, C-U-R-B 65. C means confusion. If patient is confused, then we can suspect it is severe pneumonia. And if urea level is more than 7.6 millimole, then we can suspect severe pneumonia. Respiratory rate more than 30, it is also a sign of severe pneumonia. Systolic blood pressure less than 90 millimeter mercury, it is also a marker for severe pneumonia. And age more than 65 years is also a sign of severe pneumonia. So if out of these 5 points, if 1 point is present, then patient can be treated at home. But if 2 point is present, then patient should be hospitalized. If 3, 4, 5 point is present, then you should treat this patient in intensive care unit. Now, drugs commonly used in severe pneumonia: injection ceftriaxone and injection cefuroxime, and injection clarithromycin. So injectable drugs should be used in case of severe pneumonia, but in case of mild you can give oral treatment, but duration should be 7 days. And some supportive treatment, like if patient has got chest pain that is due to pleurisy, and that can be treated by your paracetamol or NSAID. And physiotherapy, physiotherapy can be given to assist expectoration, and sometimes it is given, and follow-up of the patient. And we can discharge if patient is asymptomatic within 7 days. We can discharge the patient at home, and after 6 weeks we can follow up the patient, and by your getting a repeat X-ray chest. And but if the patient is symptomatic, and then patient can be managed at home by giving supportive treatment, but no need of antibiotics. So after 6 weeks, if the patient symptom persists and there is no resolution of the consolidation, then you can and think it is other than pneumonia. So this is the end of your today's class on pneumonia. So we have learned so many things, very common topics, especially it is important for our COVID patient also, what is pneumonia, and what are the different types of pneumonia, what are the predisposing factors for pneumonia, and what are the causative organism for pneumonia, what are the presentation of pneumonia, what are the investigation for pneumonia, and what line of treatment of pneumonia, especially your mild pneumonia or severe pneumonia, and how to follow up the patient. So I think you can understand regarding pneumonia, and you will read from your Davidson book pneumonia, and then it will be cleared. Other things are, a lot of things are written in Davidson, as for example, hospital acquired pneumonia, nosocomial pneumonia, or secondary pneumonia. I have not given so much emphasis on these things because you are the beginner. I am giving only the simple lesson about pneumonia, and later on in revision class we will go to details. This is my plan. So thank you again for patient sharing, and I pray to Almighty God for your healthy life, so that you can go on with your study, and when the national crisis will be overcome, then after opening the class, we will see you, we will meet you, and we will give you lesson. So this is the end of my class today. How are you? How are you? তোমরা কেমন আছো? হ্যালো? কয়জন হয়েছিল ওটা দেখতো? এই গতদিন আসছে 10 জন, আজকে 7 জন, এরকমই হচ্ছে। হ্যাঁ, ফোর্থ ইয়ারের ছেলে মেয়েগুলি এমনিতে একটু ডাল ডাল আর কি। আমার মনে হয় আগের দিন একটু ওদেরকে রিমাইন্ডার দেওয়া। হ্যাঁ।